Welcome to Between Two Cheeks, where we get to the bottom of your colorectal health questions. Literally. I'm Dr. Chong.
And I'm Dr. Miiles Tommeraasen. And together, we're ready to tackle the issues that affect your gut and your butt.
Between Two Cheeks. Hemorrhoids.
Today's topic, hemorrhoids. That's right, everybody's favorite pain in the rear. And trust us, if you think you've heard every hemorrhoid joke in the book, you're probably right. But for now, we'll stay cheeky.
We'll break down the truth about hemorrhoids, why they happen, are they serious, what you can do to feel better during a bowel movement, and then most importantly, can you blame them for yesterday's spicy lunch?
Stick around. We'll cover that and more on this episode of Between Two Cheeks.
What are hemorrhoids?
If you Google things like, why does it feel like there's something back there, then this one's for you. So for hemorrhoids in general, there's internal and external. Internal hemorrhoids are stuff that you were born with. They're on the inside, and they can cause painless bleeding. External hemorrhoids are what you notice externally on the outside, and sometimes they can get larger during a bowel movement. And then lastly, a lot of patients will come in complaining about severe pain that are related to hemorrhoids, and that would be a thrombosed hemorrhoid. That's actually where you feel a firm bean on the outside that's severely painful to the touch. Oh, and yeah, you're going to feel some pain with that one.
So patients frequently ask us what are signs and symptoms of hemorrhoids, and truthfully, there's a lot of different ways they can present. A lot of people will experience bleeding. Some people may experience itching. Some people may notice some tissue coming out of their bottom, amongst a few other things.
So the reasons why you would come see one of us for your butt problem would be severe itching and definitely bleeding. But otherwise, if you feel like this is a nuisance for your everyday life, then come see us and hopefully we can provide you with a solution.
So there's a lot of different ways hemorrhoids can be treated, but the thing we always start with first is getting someone on a good bowel regimen, which revolves a good intake of fiber and usually taking some fiber supplementation as well.
So if you have any problems regarding your bottom, you can definitely come to one of us and seek help. We would definitely opt for conservative treatment first, such as what Dr. T just said, with plenty of fiber, plenty of water, avoid straining, avoid sitting on the toilet for a prolonged period of time. These are simple measures that you can take to help yourself.
Ever ask yourself, why is my backside betraying me? There are many different things that can cause hemorrhoids to become symptomatic. This includes, but isn't limited to, straining during bowel movements, constipation, diarrhea, heavy lifting, inadequate fiber intake, and then also it's very common to experience hemorrhoids during your pregnancy. And last but not least, bathroom scrolling. That's right, we're talking about you. So if your bathroom visits take longer than a commercial break, you may have an issue.
Okay, so let's dive into the creams, cushions, and things you can do to calm the chaos in your caboose. So there's plenty of things that you can do to help your hemorrhoids. In terms of diet, you can always choose to undergo a high fiber diet. Next thing you can do is take sitz baths, which are really just warm water soaks that you can do to help soothe the pain back there. Ice packs can be used for relief. And there are also topical therapies that you can use that are over the counter, such as witch hazel and steroid creams. With a rubber band ligation, it's an office-based procedure where we can put a rubber band on the internal hemorrhoid. And that way, over the course of the next week, it will allow it to shrink down. For the in-office procedure for a thrombosed hemorrhoid, we would numb up that area and remove the blood clot that's causing you the severe pain.
So if you've tried 9 different creams and none of them work, it's time for a new plan.
And if your backside's been begging for a break, don't tune it out.
So the bottom line is that hemorrhoids are common, they're treatable, and they're definitely not something you should be embarrassed about. Thanks for joining us on this episode of Between Two Cheeks. If you learned something, laughed a little, or didn't click away when we said rubber band your butt, we'll call it a win.
Don't forget to like, subscribe, and drop your comments below. While we're not going to answer specific questions that you have online, you can always make an appointment to see one of us, and we will be more than happy to talk to you face to face.
Join us next time when we'll take on another awkward, medically informative, bottom-focused deep dive on other colorectal topics. Until then, stay cheeky.